Now we'll discuss the first generation cephalosporins. In the first generation cephalosporin, as you can see, there are the important drugs in which there is a cefalexin, cefadroxil and cefazolin. Okay, these are the first generation cephalosporin that we are going to discuss. Now, first generation cephalosporin, they are discovered in 1960. They are discovered in 1960 and they show high activity against gram-positive cocci. They are highly active against gram-positive cocci like streptococci, staphylococci, but weaker against gram-negative. Weaker against gram-negative. And most importantly, they are not active against penicillin-resistant strain. First generation cephalosporin, they are not active against penicillin-resistant strain. And important thing, they are also not effective against MRSA. They are not effective, or we can say MRSA is also resistant. MRSA means methicillin resistant Staphylococci aureus. It is also resistant. Now where they use? They are used in a minor infections of respiratory, urinary tract and skin and soft tissue infection. The first generation cephalosporin, they are used in minor infections of respiratory tract infection, urinary tract infection and skin and soft tissue infection. Now we'll discuss the important drugs in the first generation cephalosporin. We'll discuss the important drugs like cefazolin. Cefazolin, it is given as a parenteral drug, means it is given via parenteral route of drug administration. So the antimicrobial spectrum, it is effective against streptococci, streptococci pyogenes as well as streptococci viridans. It is also effective against gonococci, meningococci, corynebacterium diphtheria, H. influenzae, Clostridia, actinomycetes, antimicrobial spectrum of cefalozolin, and it is available as a parenteral preparation. It is not given orally. As you can see, cefazolin 1 gram. It is available as a vial, 1 gram vial. It is given parenterally. So which route is preferred? Intramuscular route, which is less painful, or it is also given intravenously and has a longer T half, 2 hours. Why? Because of slow tubular secretion. It is given parenterally. Which route? Intramuscular. Intramuscular or intravenous. Mostly it is given intravenously. And it attains high concentration in plasma and in the bile. It attains high concentration in the plasma and in the bile, and that's why it's a drug of choice for the surgical prophylaxis. After the surgery, it is given as a post-surgical prophylaxis, or it is given as a surgical prophylaxis. Why? Because it is effective against most microorganisms that are likely to cause wound infection. It is effective against most of the microorganisms that are likely to cause wound infection, longer T half, and they show good tissue penetrability. These are the reasons why it's a drug of choice for surgical prophylaxis. Cefazolin. We are discussing about the cefazolin. Cefazolin, it is the drug of choice for what? For surgical prophylaxis. And why is it so? Because it is effective against most of the microorganisms that are likely to cause wound infection, longer T half, and tissue penetrability is good. Now next drug in the first generation cephalosporin is the cefalexin. What is the advantage? It is effective orally. You can give as a oral preparation. As you can see, it is also given in the pediatric population. Vaccine, cefalexin suspension 125 mg per 5 ml. It is available as a suspension. It is available as a capsule, cefadex capsule. Means oral preparations are available, cefalexin. The antibacterial spectrum is same as compared to the other first generation agent. Spectrum will remain same, and the important thing, it is less effective against penicillinase producing staphylococci. It is less effective against penicillinase producing staphylococci, and it is where it is used. It is used for the minor infections like abscesses and cellulitis. Whenever the skin and soft tissue infection or cellulitis, or if there is any abscess related to skin, so we can go for the cefalexin in the pediatric population or in the adult population. So this is about the first generation cephalosporin.